This is the first question. So first of all, you please read the question, then we'll discuss the options. So this is the question here. 87-year-old client has been admitted to the hospital with the signs and symptoms of urinary tract infection along with agitation, confusion and disorientation to time and place. And what is the most important nursing action? So here we have to select which is the most important nursing action. So most important nursing action ആണ്. What is the situation here? Patient with a UTI. So ഇവിടെ basically നമ്മൾ ശ്രദ്ധിക്കേണ്ട രണ്ട് പോയിന്റ്. ഒന്ന്, number one is age. Age is 87-year-old client and with urinary tract infection, that is the diagnosis. Okay, urinary tract infection aana. And what are the other symptoms? Agitation, confusion, disorientation. Okay, so old age ആയിട്ടുള്ള ഒരാൾ UTI ആണ്, പ്ലസ് ആൾക്ക് agitation ഉണ്ട്, confusion ഉണ്ട്, disorientation ഉണ്ട്. Okay, so what is the most important nursing action? ഏറ്റവും important ആയിട്ടുള്ള nursing action എന്താണ്? Encourage frequent fluid intake and keeping the bed elevate and side rails raised and provide one-to-one supervision, turning the light off in the client's room. So you can just drop your answers in the chat box. First of all, read and understand. ഈ ഒരു സിറ്റുവേഷൻ മനസ്സിലാക്കിയിട്ട് അതിനനുസരിച്ച് ആൻസർ സെലക്ട് ചെയ്യണേ. ഏജ് പറഞ്ഞിട്ടുണ്ട്, then diagnosis UTI ആണെന്ന് പറഞ്ഞിട്ടുണ്ട്, and additional symptoms ഉണ്ട്. So what can be the, first of all, try to remove wrong answer. Here this particular age, patient, the patient is at risk. Why? Number one, the age itself is putting the patient in a risk. Number one. Number two, patient is not oriented. Patient is having agitation, confusion. That itself will put the patient in a danger. അപ്പോൾ ഇവിടെ പേഷ്യൻ്റ് ഒരു ഡേഞ്ചർ സിറ്റുവേഷനിലേക്ക് ലീഡ് ചെയ്യാൻ ചാൻസ് ഉള്ള ഒരു പേഷ്യൻ്റ് ആണ്. ഓക്കെ, and what is the diagnosis? What could be the diagnosis? Here it is UTI and the agitation, confusion, disorientation. Usually it is associated with the UTI. And is there any other diagnosis? Can you please try your answers? Yes. നിങ്ങളുടെ ആൻസേഴ്സ് സെലക്ട് ചെയ്യണേ. Yes, you can just drop your, try to remove wrong answer. See your situation, try to remove wrong answer and select the better. What is the first, what about first option? Encourage frequent fluid intake. Do you want to keep or do you need to remove? What about the first option? You can keep, right? Encouraging frequent fluid intake. What about second one? Keeping the bed elevated and the side rails need to be raised. That always protect the patient's safety, only the side rails raised. But what about keeping the bed elevated? Bed elevated ആയിട്ടാണോ വെക്കണ്ടേ, bed flat ആയിട്ടാണോ വെക്കണ്ടേ? It would be based, yeah, it would be like based on the patient's situation. So this is okay. Side rails need to be packed and the height of the bed need to be reduced and bed and keeping the bed elevated, that would be like not completely elevated, it would be flat. And what is third one? Providing one-to-one supervision. Continuously be with the patient, and if the patient require any of requirement, you need to closely observe that and do that. And fourth one is turning the lights off. So this is not good. So I'll just remove fourth one, and from first to second, third you need to select. Okay, so let me talk about UTI here. Always be associated with the UTI, there may be chances to get an agitation, disorientation and confusion. Is usually in old age when they develop UTI, this will be an associated thing. Okay, sometimes as a complication of UTI, there will be chances to get a delirium symptoms. UTI ഉള്ള പേഷ്യൻസിന് ഓൾഡ് ഏജിൽ ബേസിക്കലി ഡെലീരിയം സിംറ്റംസ് വരാനുള്ള ഒരു ചാൻസും കൂടെ ഉണ്ട്. മനസ്സിലായോ? അപ്പോൾ ഇത് ബേസിക്കലി എന്തായിട്ട് കൺസിഡർ ചെയ്യാം? ഡെലീരിയത്തിൻ്റെ സിംറ്റം ആയിട്ട് കൺസിഡർ ചെയ്യാം. ഓക്കെ, So here this particular child might be experiencing or going through a delirium symptoms. Okay, so here already the age itself is putting the patient in a danger, and the symptoms are also categorizing the patient is in danger. So risk need to be avoided. So the better answer for this is providing 1-to-1 supervision. What is the patient's right now, what requirement the patient is having. Okay, so you need to closely observe that, and then based on that intervention. See, encouraging fluid intake, that may not be really good answer, because here the problem is with the confusion, agitation and disorientation. അപ്പോൾ അതിനാണ് importance കൊടുക്കേണ്ടത്. So you can completely remove first one and fourth one, and you will only get confusion with the second one and third one. So the better answer is third one. Please learn UTI ഉള്ള പേഷ്യൻസിന് വരാൻ സാധ്യതയുള്ള ഓൾഡ് ഏജിൽ ബേസിക്കലി UTI വരുമ്പോൾ UTIയിൽ വരാവുന്ന ഒരു കോംപ്ലിക്കേഷൻ ആണ് UTI associated with the delirium. Clear? Doubts ഉണ്ടോ? Yes. Any doubts?